Hi, myself Dr. Girish AC, consultant plastic and cosmetic surgeon. I am heading Curls and Curves Cosmetic Surgery Center, Vijayanagara, Bengaluru. So today I am going to explain about the gynecomastia and gynecomastia procedure, how we perform step by step. First, the meaning gynecomastia. Gynek means female, mastia means chest. So female type of chest changes happening in males, especially between the ages of, which is commonly seen between the ages of 13 to 14 years, from there to maybe around 20 years. So it is very commonly seen age. But once happens, it will grow or it will remain, the size will remain same. So there is no chances of it is going down naturally. So left alone for long time, it will remain same or it can increase in the size. No chances of decrease in the size. Very rarely, in 1% of the cases, when left alone for long duration, and especially after the age of 40 plus, the chances of male breast cancer is also there. That is very rare, but it is we also have come across such several cases. The most common the issue here is the problem with the psychological problem having such issue or gender identity problem there. So they will have a lot of inhibitions and they will be very conservative in nature, and they will be wearing loose cloths to cover up the area, or the jackets, pullovers, such things they will be using, and they try to avoid the people, maybe friends and relatives, for the same sake, and they may not participate in the physical activities outside, maybe swimming or the outdoor activities. So finally, so they are very much embarrassed. They are very much embarrassed about the problem. So they want a solution. They try several. So it may be the gym work or diet. Since the gynecomastia is usually the excess fat and excess gland, so the excess fat to some extent can be reduced with the exercise and diet, but may not with the glandular part, which is very hard. So there won't be any response for such things. So then the best and the permanent solution will be a gynecomastia surgery. So the people try about the gym and the diet, thinking or assuming it is only fat excess, but that is not true, and it does not regress totally. So finally they end with the problem as it is. So today I am explaining about the gynecomastia. Now you can see there is a excess fat, and this is the glandular part, which is very hard to hold. If the self-examination, one can analyze themselves by holding this way, like doing a pinch with the two fingers, and it will be very hard structure will be felt behind the nipple areolar complex. Here it is all excess fat surrounding. If we remove only the gland, so there will be just a depression there. The surrounding fat looks still there, it will be there. So the best solution for such things would be to tackle both excess fat in the surrounding region completely, as well as removing the gland. So then before going to the procedure proper, let me explain about the grades, the classification or the grades of gynecomastia, which everyone will be interested that which grade of gynecomastia they have. So there are the two types of classification, and one will have 3 grades, and grade 1, grade 2A, 2B and 3, and in another classification 4 grades are there, grade 1, 2, 3, 4. So I am just following that 4 grade classification, and in this case it is grade 3, which is sagging and down from the normal level of nipple complex. In grade 1, there will be just a glandular enlargement just behind the nipple complex, but no excess fat. In grade 2, the excess fat and the glandular enlargement, generalized enlargement will be there, but nipple complex will be in the normal position. In grade 3, the nipple complex will be down below the level of normal level. And in grade 4, it will be too saggy and looking down. Nipple complex will be looking down. So this is grade 3. And I am just marking the area now of the excess, the whole gynecomastia part. And here our aim of the surgery is not only to remove the gland, but also to give him the normal chest contour. To achieve that, so we need to do a liposuction to remove the excess fat and glandular excision. So we usually make one incision in this anterior axillary fold, in that junction, one hole here, and we do liposuction of entire area using the power assisted liposuction, ultrasonic liposuction or laser liposuction. So once we are done with it, so what is left behind is the glandular enlargement. And the glandular enlargement is taken care by the incision in the lower half of the areola. So only the lower half of the areola. And we once we put the such incision, the scars won't be visible in the long duration because it is at the junction. And the stitches are put only inside, no external stitches. So thereby we are avoiding the stitch marks. Overall, so they will have the normal chest contour which happens immediately post surgery. So we are tackling even the lateral chest, so that when they are in the normal position, the chest will have normal chest contour, and so everyone will be worried about the scars. So finally these scars also will disappear or will not be visible, and this scar, because since there are no stitch marks, it is also nobody can make out that we have made an incision there. So finally it looks normal. All our aim is to make abnormal to normal, and normal happens immediately, and this is going to stay for a long time or permanently. So after the surgery, so we are going to show him any clients, whatever the fat removed will be shown to them, the gland removed will be shown to them, and also immediately the normal chest contoured achieved will also be shown to them. So which is immediate and in the long run. Few people just remove the gland. So what happens? It causes saucer shaped deformity. In the sense, there will be a central depression and excess fat in the surrounding region. So which is cosmetically or aesthetically not acceptable. So even then the one problem is taken out, but the chest won't appear normal or natural. Next is how it is done. Basically, there are two ways of doing gynecomastia surgery. One is doing under local anesthesia and another is under general anesthesia. So I prefer to do it under general anesthesia for the reason that the client should not have any pain during the procedure, so that we can execute the procedure to the best level. And if we, even while injecting the local anesthesia, the client will be having the pain, then the results will be incomplete, because since the patient is, if they have pain, we cannot do or justify a proper procedure. So we always prefer general anesthesia, which is always safe. And we have our good team, the experienced team, and we are doing this gynecomastia surgery since more than almost 18 plus years, and our team is also equally trained senior anesthesiologist. So they are also know how to give the safe anesthesia. So one need not worry about the anesthesia part. So everyone will have the results. Even anesthesia is very safe. So next, now we will proceed for the procedure. So before that, I am just highlighting the glandular part. So this is excess fat surrounding. So we are done with it. If the client is also having excess fat in the tummy part, we do suggest to undergo surgery together so that final uniform contours will be there, proportionate will be there, because in the males usually these are the two regions where the excess fat can be deposited. If they are having the even excess fat in the abdomen, so we can combine and give them a uniform contour. So now we'll proceed for the surgery. For gynecomastia surgery, along with the improvised techniques what we have adopted ourselves over 18 years of experience, we have also adopted the technology which is very useful for the best outcome for any type of liposuction surgery or gynecomastia surgery. The first one, the ultrasonic micro air liposuction console or instrument, what I can say. So after that, you can see here, next is the powerful infiltrator, which helps us to infiltrate the fluid in a fast manner so that the entire area can be covered in a very short period. So the next one is, the lower down is the Vaser console or Vaser machine. So where we can make use of to vasering the fat. So it disperses the fat, which makes the fat to aspirate very comfortably. So this is the few instruments. So this is belongs to that micro air, also called as power assisted liposuction. So these are the cannulas what we use. This is infiltration cannula. So these are the liposuction cannulas of multiple types. And this is the vasering machine, the tools what we use for vasering. The first step is I just made a hole in the marked area in the anterior axillary line. So now I am infiltrating the fluid using the powerful infiltrator. So this is the tumescent infiltration. The tumescent fluid is a mixture of the saline with vasoconstrictive agents like adrenaline, and which controls the internal bleeding, everything, and which makes the the liposuction bleeding free. I have done my infiltration as well as vasering. So after vasering, now I need to do a suctioning. Vasering will disperse the fat, that is an energy device, and it also contracts the skin. So now whatever the fat is there, we need to remove, suck it out through power assisted or ultrasonic micro air liposuction apparatus. So this is the cannula what we use. There will be multiple types of cannula, sizes of cannula. So now I'm going to do the power assisted liposuction now. So now I have completed the liposuction on both sides with the single hole as mentioned in the anterior axillary line, which is in the hidden area. Now you can see the pinch test, that is only the normal fat left behind. Our aim is to remove the excess fat and leave behind the normal fat. So this is the pinch test I am showing you. The normal fat is left behind. So we are just removing the excess fat, leaving behind the normal. On both sides you can see equally the fat has been removed, and symmetrically the fat has been removed. The contouring has been done. So now you can see this is the left out part, that is a glandular enlargement. So now we are going to remove this glandular enlargement. Excess fat is removed. Now we need to remove the excess gland and leave behind the normal cuff of the gland, that is only 2 to 3 millimeters. Now we can see the incision will be in the borderline, the lower half of the areolar junction, areolar to skin junction. So now I am going to make an incision and remove the gland as it is through the same incision. So without extending the incision. After that I will be closing with the inside only absorbable stitches, which absorbs in maybe 1 month's time. So now we can see the fat removed. So it is around roughly 1 liter of fat. Maybe the fluid part is around 200 ml. Then it comes to around 800 ml of fat what we have removed on both sides. So now we have removed the glands on both sides. So more or less it looks symmetrical, and I can see the glandular whitish tissue in both sides. So this is the glandular part, and surrounding the fat, it is admixed, means it is mixed with the fat. So now the gland is also removed. So we have done a thorough liposuction of the entire, the front and the sides of the chest on both the sides, and the whole gland is removed through this very small incision, and we have put inside stitches only. So there won't be any further outside stitches won't be there. So we will just put some plasters there so that it will become looks like normal. Now the dressing is over. We have put inside the pads. Over that we have put absorbable under pads, and over that we have put this pressure garment. The purpose of underpad is the leak will happen through the tiny holes in any liposuction area for initial 1 or 2 days. So this underpad will absorb that leak, and the pressure garment won't get stained, won't become wet. After the general anesthesia, the patient will be awake and will be normal. So maybe he will take some rest for initial 2 to 3 hours, then he will start having liquids orally. And same day, today evening, we are going to discharge him around 6 p.m. After that, once he go home, he can have his dinner tonight, and from tomorrow he can have normal food, but only for the sake that little dressing will look slightly bulky, he will stay at home for initial 2 days, and he will come back on day 3 for the dressing removal. And once we remove the dressing, we put waterproof plaster for the tiny dot hole and around the nipple areolar complex, so that he can start having bath. And from day 3 he can do all his routine activities. He can go outside, carry out his routine activities. Even he can ride or drive the vehicles from day 4. His next visit will be on day 10, where we remove the waterproof plaster and ask him to do the massage, that is self massage. He will do himself, and we will teach him how to do the massage. The purpose of massage is that to settle the little swelling and hardness happening there. And these some temporary changes will be, that is some swelling, the hardness, and the sensory disturbances will be there initially. But all these things will settle in 2 to 3 months of time. He need to wear this pressure garment for next 1 month, and except during the massage and while having the bath. He can carry out the major physical activities like gym and all from 1 month onwards. Whatever the solution, he will enjoy for the lifetime. It's a permanent solution. The glandular development won't happen, and the contour, the look wise, it looks very natural and normal.